I recently spoke with Congressman Drew Ferguson from Georgia about his work championing legislation to combat antibiotic resistance. Take a listen to our conversation. Congressman Ferguson, thanks for joining us today.
Glad to be with you.
This issue of antibiotic resistance, you've introduced legislation with Congressman Doyle, a Democrat from Pennsylvania, called the PASTEUR Act, that would tackle this problem. This is a bipartisan bill. Can you describe it and its chances of passage this year?
Yeah, so we recognize that not only here in the U.S., but globally, we have a real problem with bacteria that are resistant to the antibiotics that have been produced. And I think we need to recognize that we have the economics of antibiotic research and development and production are not working not only here in the U.S., but around the world. And there's some very dangerous bugs out there that are creating significant amount of fatality around the globe. So what we've done is we've identified where a major problem in the development and the distribution of these drugs exist. And that is from the time that the drugs are researched and developed, when they have to go through this long phase of approval with the FDA, and then they have to find a market. And what happens all too often is that we push drugs to the development phase, but then we got to pull these drugs into the marketplace. And what the PASTEUR Act does is that it pulls the drugs into the marketplace, and it makes sure, and basically what it does is it ensures that the drug maker and manufacturer of this is not going to go bankrupt while they're waiting for these drugs to come to market.
And this legislation, I mean, it's sponsored. I was looking at this morning, 40 in the House, 40 co-sponsors, 20 Democrats, 20 Republicans, Ted Lieu, who's on the left, Markwayne Mullin on the right. This has been referred to a number of committees, including the Ways and Means Committee, Energy and Commerce. You sit on the Ways and Means Committee. When it's sent to so many committees, because this is such a vast piece of legislation, that can complicate things. Are you confident that it can move? There's a Senate companion as well. I mean, there's some momentum here, but is there enough momentum to actually get it done?
Well, we know how important the problem is, and the fact that you've got this many co-sponsors on both sides of the aisle shows that this is a bipartisan and a bicameral issue. So the reason that it touches so many committees is that one of the benefits of this plan, this subscription type service that this legislation would create, is that in return, the federal government would also get access to these drugs at virtually no or very reduced cost. And so that means everybody from Medicare to Indian Health Services to the VA to DOD, all of these different agencies that provide some level of health care for groups of Americans would have access to these antibiotics that have been produced. And so that's one of the reasons for that it seems complicated. However, there's a real benefit to each of these entities. And we think that it's going to be a positive that we've got so many folks that are engaging from such a broad cross-section of both conferences.
Now, Congressman, you said antimicrobial resistance is a looming public health and national security crisis that may one day be our next pandemic if left unaddressed. So how has the pandemic changed our thinking and policymakers' thinking around future preparedness? And will public health preparedness become more of a priority now that we've had the pandemic?
So, look, we've learned a lot of lessons during the COVID-19 pandemic. One of the things that we've seen, and one of the great success stories out of this, is that because we had been doing research in the area of viruses for so long, and we were looking and all of the work that had been done with the mRNA technology, we had stuff in the pipeline and we had technology that we could adapt to produce a vaccine. One of the problems that we have with bacteria right now is that we don't have that same pipeline of products and research that have been moving forward. We take for granted all too often the fact that the antibiotics that we have that have been so successful, they almost appear as miracle drugs in so many cases, and we take that for granted. But the bacteria around the world are really evolving, and they're evolving at a very quick rate for a lot of different reasons. And so what we've got to do is we have to have this pipeline of technology ready to go. We got to have products ready to go. We're going to pay for this now, or we're going to pay for it later. And it's always cheaper to do it on the front end and be in a preventive mode than it is in a reactionary mode in the middle of a disaster. So, one of the things that we've learned about pandemics is to be prepared and to be thoughtful. And there are a lot of different components to it, but this is a really important component to it.
As far as the cost, and you mentioned that, and cost is always a big concern in Washington. But the cost of developing antibiotics is significant, and sometimes the payoff is not significant. As you say, many Americans, we take for granted the treatments that are out there, the antibiotics are out there. How can policymakers incentivize for production so it gets to people who need it?
Well, look, we've got the research and development component here. So what we lack is funding for these drugs to get them across the finish line into the marketplace. And keep in mind, a lot of the drugs that are made are long-term care drugs, things dealing, for example, with diabetes. If you're diabetic, then all too often you got to take insulin for the rest of your life. Cancer treatments tend to be longer types of treatments. However, if you have an effective antibiotic, usually that's a short-term treatment, and then the patient doesn't need it again, hopefully ever. And so the volume that a manufacturer needs to sell to make up for the research and development costs and bringing the drug to market, they look at it and go, well, the return on the investment isn't that great. What we're trying to do is to incentivize that development and getting it to the marketplace with the Pasteur Act. So again, think of it as we push the drug through the development phase. Now we're pulling it into the marketplace, and we potentially can save billions, if not trillions of dollars on the back end. And most importantly, we can save tens of thousands of lives every single year. I think there are over 40,000 deaths in the U.S. alone due to these resistant bacteria, and that we just simply don't have antibiotics to fight them. I saw this very early on in my dental practice. I was a practicing dentist for more than 25 years, and this is something that we fought constantly, the evolution of bacteria that basically made it more and more difficult to treat very serious infections. And this is something that's going to continue to be an issue going forward.
So is that what got you into this issue? You mentioned your background in dentistry. Is that something this is where you started to hear people / constituents saying this is a real problem?
Well, look, it's certainly, based on my background, I was very aware of it. And I've also experienced it firsthand in the clinical setting. But also looking at the overall development of these products from a pandemic standpoint also got my attention. And here's the other thing that I think that another driver in the interest here is that we've seen what's happened before is these smaller companies develop these unique antibiotics and they go bankrupt waiting to get the product to market. And what happens is sometimes our adversaries will come in and buy that intellectual property or buy that company for pennies on the dollar. And when that happens, then guess what? China gets the technology, they get to produce the antibiotics. And once again, we are at the mercy of one of our adversaries in getting the resources that we need. So this becomes a national security issue as well, that we want to make the things that Americans need right here.
Just last question. As far as it getting over the finish line, what's the role of stakeholders? Can they push for more? And if it doesn't pass this year and the House flips, would this be a priority for you in the new Republican-led House?
Yes, it's going to be a priority going forward, but let's get it done now. The sooner we get this done, the better chance we're going to have at getting better results sooner. We don't know when the next pandemic is coming, but we know that there will be a pandemic. And so if you go back and look over over hundreds and hundreds of years, we know that this is going to happen. So let's get it done now. So for stakeholders, again, talking about the importance of doing this, looking at the Pasteur Act is a good, solid, viable solution, and talking about the benefits of this. If stakeholders will do that with members of Congress, and I think we've got a real shot at getting this across the finish line this year. And that should be our goal, is to get it sooner rather than later.
Yeah, certainly an important issue that doesn't get as much attention as it deserves. Congressman Ferguson, thanks for joining us today.
Thank you. Glad to be with you.